Hi, my name is Dr. Ala, and today's video is going to be about scabies. Scabies is defined as a highly contagious skin infestation caused by the mite Sarcoptes scabi. The reason why it's called an infestation instead of an infection is because infections are usually due to microscopic pathogens like bacteria, viruses, fungi, and protozoa, whereas infestations are due to more larger parasites like mites, lice, ticks, or worms. The transmission is going to be skin-to-skin contact, and this is the most common scenario. Otherwise, fomites transmission can also occur. Fomites are basically inanimated objects or surfaces that can become contaminated, and this basically happens because mites can stay alive outside of the skin for another 2 to 3 days. So the pathogenesis goes as follows. The mite burrows into the epidermis, which is the most superficial layer of the skin, where it lives, lays eggs, and leaves feces. This is going to be followed by an asymptomatic period of 3 to 6 weeks. After this period, the patient is going to have symptoms. This is an example of delayed hypersensitivity type 4 reaction. The reason why it's called a delayed hypersensitivity reaction is because the symptoms are not from the mite itself, but because the immune system is trying to attack the mite. This asymptomatic period is regarded as the sensitization period. It's basically when the T cells are trying to recognize and understand what is going on. Once that happens, the T cells are going to mount an attack against the mite, and that is what's going to lead to the itchiness and the rash. If that same person gets reinfested with scabies, there's not going to be an asymptomatic period of 3 to 6 weeks because the immune system would already have understood what's going on, and instead they would get a rash in 2 to 5 days. So the clinical features are going to be an itchy rash. They're going to say that it's the worst itch of their life and that it particularly occurs at night. Why it happens at night, we're not exactly sure. It could be because the skin gets warmer. It could be because the mite itself gets more active. We don't really know. But it's very key when they say it happens at night, and it can be a classic sign for scabies. The rash is going to be an erythematous papular rash. It's going to be a generalized rash, but it occurs most commonly in the limbs and the trunk. There's going to be scratch marks and burrows. So this image helps us get a better understanding of what's going on. The mite is going to create a small tunnel on the epidermis where it's going to live and lay its eggs and also feces, and that tunnel structure is called a burrow. A burrow is basically a whitish gray wavy line. It's around 2 to 12 millimeters in length. Here we can see an image of burrows. This is it, here, here, here. However, because the rash is very itchy, there's going to be a lot of scratch marks that actually end up hiding the burrows. These are some more examples of scabies. You see it here in the palm of the hand. It's very classically seen in the webs of the fingers. It can be seen in the foot. Like I mentioned, the common locations are the limb and the trunk, so you can also find them in the wrist, elbows, axilla, waist, genitalia, as well as the buttocks. The scalp and the face are usually going to be spared in adults, but they can be found in infants and elderly. The classification of scabies is going to be divided into classic and crusted. Classic is just the form that occurs in normal healthy individuals. Crusted is what occurs in immunocompromised people, disabled, elderly, or people taking very potent steroid creams. It's an uncommon variant, but it's very highly contagious. There can be around 1,000 mites to actually 1,000,000 mites in the skin. So this is how crusted scabies looks like. It's going to occur in those patients who have an impaired cell immunity. There's going to be a thick crusted plaque and actually minimum itching. So the diagnosis of scabies is usually clinical. There's going to be a presentation of an itchy rash, and it's usually going to be occurring at night. There may also be a history with a family member who had the same rash a few weeks ago, or it could be their roommate or flatmate had a similar rash as well. The condition can be confirmed with a dermatoscope or a light microscope. So this is how it would appear on a dermatoscope. It's basically a handheld device that dermatologists use to magnify images on the skin. So you can see here, this is a barrow, as we talked about before, the whitish wavy line. And on top of that, you can see the mite. The mite has this like triangular structure that's dark brown. Otherwise, you can take a skin scap and see under a light microscope the mite, the eggs, and the feces. The treatment is going to be with topical permethrin. Otherwise, you can use oral ivermectin. The cream has to be applied from neck to toe. Keep it for 12 hours and then wash it away. And this routine should be done again after 1 week. Oral ivermectin is for patients who for some reason didn't benefit from the cream, or they don't have access to the cream, or in the case of patients who are immunocompromised, in elderly patients, in patients who cannot put the cream on if they're disabled, for example, and in cases of outbreaks where you need to give a treatment to a large number of people at the same time. One of the most important facts about treatment is that you don't just treat the patient, but you also have to treat all their close members, because they can just get reinfested over and over. Decontamination is also very important. Clothing items, bed sheets, towels, all of these should be cleaned in high heat. If something can't be washed, then it's recommended to put in a bag for more than 3 days, because as we said, mites can survive for around 2 to 3 days.